Good afternoon. I'm Lauren Peterson, United Way board member and Senior Director of Relationship Management at TechPoint, which is a mission-driven nonprofit focused on growing our state's tech ecosystem. Welcome to Zoom In on Our Impact, a virtual donor appreciation event where I'm lucky to spend the next hour with you learning how our gifts to United Way have really powered Central Indiana's response, recovery, and eventual rebound from the health and economic impacts of COVID-19. We're so happy to have you, each of our many guests, our community members, United Way staff members, and nonprofit partners, and others who have joined us today. We're delighted that you're taking some of the time that you have to learn more about how COVID has impacted the work of the human services sector and how your individual involvement with United Way has really made a lasting impact on the lives of our neighbors that are struggling to make ends meet during these uncertain times. To start us off, I would like to introduce Rafael Sanchez. I was going to say he's the one and only, but he's not the one and only. Rafael is not only the United Way board chairman, he is also the president of private banking at Old National Bank. Rafael, it's so great to see you. Thank you so much for joining us and welcome.
Thank you, Lauren, for that kind introduction, but make no mistake about it, I am the one and only, no matter what the other Rafael Sanchez says. But in all seriousness, I'm really happy to be here, be a part of this event. It's really cool. It's where we get to thank all of you, our donors, for all you do to support United Way. And as Lauren mentioned, as board chair, it's my absolute privilege to lead and serve United Way of Central Indiana. Little did I know that, a year ago, I would be leading and serving this remarkable organization through arguably the most critical time in its 100-year history. You hear it a lot on the street. This COVID-19 pandemic is truly unprecedented, and it's true. But interestingly enough, this isn't the first time United Way has been the beacon of hope to its community during crisis. Now, this may sound like something straight out of the History Channel for some of you, but the reality is that because of the generosity of thousands of donors like you, we've helped our community survive the negative impact of the 1918 flu epidemic, world wars, terrorist attacks, and economic recessions. So even though COVID-19 has changed our world forever, and that much is true, I feel better personally knowing that United Way was built for times just like this, and it has a proven track record. Now, we knew in early March that there were families out there who are already struggling to make ends meet on a regular basis. And all that was well before getting hit hard with quarantines, layoffs, food and emergency supply shortages, limited ability in their own circumstances to observe social distancing, and of course, lack of basic health care. So an already challenging situation was made even worse. But as soon as the virus reached our community, United Way rallied. And we weren't alone, to be sure. We were proud to join other founding funders like the Lilly Endowment, Inc., Central Indiana Community Foundation through the Glick Fund and the Indianapolis Foundation, Eli Lilly and Company Foundation, Nina Mason Pulliam Charitable Trust, Richard Fairbanks Foundation, to create the Central Indiana Community Economic Relief Fund, or CSERF for short, which has through 4 rounds of funding, all administered by and through United Way, awarded more than $23 million to more than 200 nonprofit organizations in Central Indiana. Now, a big part of the success of this initiative was the overwhelming response from you, our community members, who gave so freely and generously during such a great time of need. On behalf of tens of thousands of families across Central Indiana who received relief at this crisis moment, thank you. I can't say thank you enough. We can't say thank you enough. Like you, I'm ready to put 2020 behind us. The Christmas tree has been up in my house since well before Thanksgiving. it's like pressing fast forward on the VCR. For you millennials out there, you can call me after this event and I can tell you what a VCR is. But I'm ready for 2021, the year when, as Lauren mentioned, we help our community and all those suffering recover and rebound. But before we do, this event is for you as we take a moment to pause and reflect on where we've been and how we responded to such unprecedented need. You, our donors, get a firsthand look at the impact you made in 2020. We also want to look forward as we continue collaborating with partners all across the region to assess the ever-changing needs of families in our community. So with that, I will turn it over back to you, Lauren, to introduce our first guest this afternoon.
Truly is a special time to be a part of this important work. Thank you so much, Rafael, for your remarks and your leadership and for joining us this afternoon. So as we begin our program, I do want to recognize the role that United Way has played in really helping our community respond and recover and ultimately, as we mentioned, rebound from this COVID-19 season. United Way and its network of community-based organizations have risen to the challenge of this time again and again over the past year. And so to help us learn more about United Way's response and leadership in the human services sector during these last 8 months, I'd like to welcome my friend Sarah Van Slambrook, who is the Chief Impact Officer at United Way of Central Indiana. Thanks so much for being here with us, Sarah.
Thanks, Lauren. Thank you, Rafael. And I want to thank each and every one of you in the audience today who give, advocate, and volunteer for your community. 2020 has been quite a year. I think we all have our own stories of people that it's affected in its own ways. The adversity from the coronavirus pandemic, the economic downturn, and the growing awareness of ongoing racial injustice in our community. But I'm not here today to talk about the struggles. I'm here to talk about hope. I love that Rafael talked about that beacon of hope, because that's really what Giving Tuesday and what the spirit of United Way is about creating that hope, the hope that sparks when a family receives rental assistance to ward off eviction, the hope that grows when community organizations work together to solve a problem like food distribution in their neighborhood, the hope that comes from so many of you that give of yourself to make our community better. When I think about United Way, and when I hear so many other people think about United Way, one of the first things that comes to mind is grant making, and I'm going to talk about that. But I also want you to hear and see today that United Way is about grant making and so much more. We like to think about our impact across 6 pillars of work, and I'm going to talk to you about those just briefly. You can see them here on your screen in just a moment. There we go. Grant making, capacity building, advocacy, data, thought leadership, and programs. And I want to just take a few minutes to highlight some of the examples in each of these that have happened over the last 9 months in response to COVID-19. So you heard Rafael speak about CSURF. We are so grateful to the many, many organizations and individuals that gave generously to that. We collaborated with other funders to invest $23 million in 200 organizations and did that in less than 4 months' time. It was a tremendous outpouring and a tremendous community response. So many of you have heard of that, and we talked about that before, but did you also know that we invested in technology for organizations to provide virtual programming so that they could reach people in their community? We also invested in PPE supplies, the face masks, the hand sanitizer and other cleaning supplies to cover those unexpected new costs that every organization had to come upon. And we also invested in modifications for facilities so that those that were already open could do some of the things like plexiglass and handless door entry, and others that could open, newly reopen their facilities safely. In capacity, we hosted a series of webinars and office hours around PPP loans. You may remember that from back in the spring. There were the federal government had these loans for small businesses and nonprofits, and there was a lot of concern that nonprofits may be not given as much opportunity because they just don't know as much about the loans. And so we offered a lot of assistance around just getting information out and answering questions and connecting to resources. We also connected community partners with consultants to help them think about how to update their technology and how to modify their facilities in response to what was happening. We've advocated at the local, the state, and the federal level to increase access to resources for our local communities. We've tracked data and shared ongoing information with 211, which is the local access point for those who are needing resources via computer or telephone, and also with our local government through the city of Indianapolis and their web presence around how to access resources locally. In thought leadership, we have regularly co-convened with community organizations. At first it was weekly, so every week we were doing it, and then we switched to bi-weekly as the months continued on to talk about what were the emerging issues. How could we identify collaborative solutions and problem solving? And sometimes it was just to lift each other up because things were really hard. We also had work programmatically. So we distributed masks in partnership with Deloitte. We advised on e-learning solutions in partnership with the city and Fairbanks and others, and also offered a number of virtual volunteer opportunities to try to connect the need with the resources of volunteering. United Way did all of these things while continuing our ongoing work that included an additional $15 million in grant making. Again, always with that grant making, time to convene around peer learning and sharing, data collected to build dashboards and be able to share that more broadly, advocacy around pre-K supports, and so much more. In the midst of a difficult year, knowing that our community has come together to increase food access, give e-learning supports, provide rental assistance, decrease senior isolation, and connect to mental health services. All of those things are what give me hope. And I hope that as you hear today, that you are able to walk away with that same sense of hope from hearing from our many partners that are here with us. So with that, I'm going to pause because I know Lauren has some questions she'd like to ask.
Thank you so much, Sarah. Wow, just hearing that this was not only the first of its kind fund, but all of the collaboration that went into raising and distributing $23.5 million over 200 organizations is just so remarkable. Thank you so much for highlighting that, Sarah. So I'm curious, as United Way was working with all of those other funders and partners and government across the community to allocate those necessary resources and responding to the critical needs, how were you and your team able to track those most critical gaps to ensure that all of the resources were being appropriately deployed to fight those most emerging needs?
So there was a lot of conversations, individual conversations, group conversations, community-wide conversations. I mentioned those co-convening calls. So we were talking with usually about 100 different nonprofits in those early months on a weekly basis, hearing from them what is the key emerging issues that are facing our community right at this moment. We also had a lot of people calling us directly, and we were reaching out directly to churches and to nonprofit organizations, many of which we'd never encountered before, because COVID reached so many spaces that haven't been touched in the past. You know, we know that there are many individuals that are living in poverty or they're one step away from poverty, and those numbers have increased dramatically because of the pandemic and the economic downturn. So having those calls with providers, having conversations with people in the field around particular issues, as emerging issues popped up, then we would bring together small groups or meet together with small groups that were already convening to be able to solve for problems. So one example around that is around childcare. When the schools closed in the middle of March, everyone understood that that was for the best of our community in that moment, but also struggled with, okay, well, how do first responders and healthcare workers continue to do their job, which is absolutely essential when their school-age children now don't have a safe place to be. And so within a few days of that, we're able to work together with the city of Indianapolis, with the hospital association, with board members from United Way, with providers, and sit down and really map out, okay, what is it? What is the need? What are solutions to make that happen? And we put a plan in place to be able to fund through CSRF a number of organizations and start small, not knowing exactly how many people would need that support, but a plan to grow that over time, whether that was a few days or a few weeks or what has turned into many months, to be able to provide that support for families who really needed a safe place for their kids to be in the midst of providing all of us with those essential services. So that was just one example that that really took shape in a short amount of time, but was essential to be able to meet the needs within COVID.
Yeah, thank you for sharing that example, Sarah. And I know that we've got several donors joining us on the call today, and I assume that, like me, they feel it's really reassuring to know that their dollars are going as far as possible and to the greatest areas of need. So in times where it seems like nonprofits are always innovating and finding creative ways to serve their neighbors, can you share with us how the team and United Way's network of community-based organizations are truly collaborating and working together in new ways to make that happen?
Certainly. So I think one of the great examples is around food. So if you have been following the news at all from March and through now, the increase in need and demand for food has been much higher than it is in usual years. And so our partners like Second Helpings, who you're going to hear from later today, and Gleaners and others in the community who provide that essential food network, that safety net, were really strained during this time. And one of the great things that we saw happen was on these phone calls where we had many different providers who are focused on different parts of our population, right? So we have senior serving and child serving and adult serving and food focused and focused on disabilities and all of those sort of coming with their own lens and their own solutions. And immediately it started popping up from every population and every community, right? We need food. And John Elliott was on the phone and Jennifer Vigran were on the phone, and they said, we've got you, right? And so started immediately making connections with, okay, well, how can we get food distribution sites that are close to these? Could you come pick up food so that we can bring it to your neighborhood? And so there was really some great collaboration that happened around getting food to where people needed it most, and doing that in a way that wasn't duplicating, but was connecting into the existing network of food providers. So that was one really excellent example of collaboration that happened. And I think another one is around rental assistance. There is a network of community centers that have been around, some of them for more than 100 years here in our community. And in partnership with the City of Indianapolis, with the Lilly Endowment, with United Way, and so many others have built out a partnership with each other to be able to support providing city dollars for rental assistance so that people can ward off being evicted from their homes. With so many people losing their jobs over this time, the economic strain on so many families has been very high. And so after food, one of the key things that pops up is how do I keep my home? How do I keep shelter over my kids' head? And so being able to provide that network of organizations working together, others investing, through CSURF, we invested in legal services to be able to help when it does get to the point of eviction, then how can they get the legal advice that they need to be able to do that. So really trying to pull from every side of things in, again, within the existing network, but then also bringing in others. So one of the things that was really great about this network was it built on the existing network, but then brought in a whole host of other partners who are very connected to the community. So, so churches and others who are hearing from their congregation, or a small nonprofit that is hearing from their block of what they need, and being able to tie those needs back in. So those groups were also tied into the rental assistance program that was led by the community centers, and tied together around that collaboration. So really proud of the way that both building on what we already have, but acknowledging and noticing and bringing in new partners in new and different ways to be able to layer and leverage the resources that we have as a community has been really exciting to see just how all that collaboration can happen.
Sarah, that's spectacular. Thank you for those specific examples as well, so that we can start to wrap our heads around how those neighbors in the community are really being impacted by this work. And thank you for the amazing work that you and your team are doing to help the local community recover from the health and economic impacts of COVID-19. We really appreciate you being with us this afternoon.
Absolutely.
Alrighty, switching gears now, I want to be able to introduce our next guest and segment who will be joining us virtually. United Way partners with a vetted network of community-based organizations who tirelessly work to bring programs, resources, and care to individuals and families who are struggling to make those ends meet. And just as the pandemic has altered the ways each of our businesses, our schools, and even places of employment can safely operate, the leadership and staff in Central Indiana's nonprofit community was forced to innovate in new ways to deliver those services and continue to meet those needs of the individuals and families they serve. So let's hear from one of those community-based organizations right now. Damien Center has as its mission to empower persons in Central Indiana affected by HIV and AIDS. Here to tell us more about their response and how each day they are helping to support those neighbors fight that charge with dignity and to help to prevent the spread of HIV is their CEO and president, Alan Witchy. Please tell us more, Alan.
My name is Alan Witchy. I'm the president and CEO of the Damien Center. The Damien Center has been around for 33 years. We've been providing direct supportive services to people who are living with HIV or at high risk for HIV. Those services include food, housing, medical care, mental health, and other supportive services to help people in the moment that they need it the most, when they're most in crisis, to create stability and self-sufficiency. We had no idea that things were going to change so dramatically this year. We were living our normal lives at the Damien Center, providing services and doing all the things that we do, the important work we do. And when COVID hit, everything changed. The whole world went upside down. And at the same time, we knew we had to stay here and stay true and stay strong for the people we serve. So we immediately tried to mobilize and do the most we could to continue to support people, and at the same time figure out how we could be safe for our clients and for our staff so that we didn't have people become infected with this disease. It was really tough at times because we were not prepared for this. We didn't have the technology that we needed. We didn't have the reserve funding that we needed. And the amazing thing was United Way stepped up to help us with technology when we needed it the most. We had these CSRF funds that came in and helped fill in gaps for us. Services that we weren't able to claim fees for, donors that weren't able to make donations, a whole host of reasons that we were short funding that we otherwise would have had, that we knew was coming in a normal year, but didn't come in this year. So this year, it turned the whole world upside down. It turned our world upside down. And we needed help and support to rebalance and to adjust to this world. And we got that through the CSRF funds and the support that we got from United Way. So it really was critical. I can't say it enough that we could not have done all the work that we did without the support from the CSRF fund and the support from United Way. I really thank everyone who was involved with it, everyone who supported the fund, everyone who helped administer it. It was really amazingly well done in the community, and it really came at the perfect time to help us when we needed it.
As we move into the next piece of our program, I'm truly honored to be joined by 4 amazing nonprofit leaders today who are serving on the front lines of our community's response to COVID-19, like you heard from the Damien Center. These United Way partners and the organizations they serve are here to share their perspectives and real life experiences with us. Their stories are of perseverance and collaboration and innovation are really inspiring and provide hope for the future, even if we know it's going to be a tough road ahead. Please help me welcome Jennifer Vigran from Second Helpings, Tarek Brown from CICOA, and Barato Britt from Edna Martin. Welcome to the three of you.
Thank you.
Thank you.
Thank you. Tarek, let's go ahead and start with you. In which ways did you see the CSER funding make the continuation of your work at CICOA possible?
Yeah, thanks for that question, Lauren. So at Sakoa Aging and In-Home Solutions, our primary thing is about ensuring older adults and persons living with disabilities can remain independent for as long as possible in their own housing or their own homes or communities of their choice. And so when COVID really hit us, CSERF was it was really a blessing for us to have the ability to request and apply for those funds, because it really did help us shore up our senior nutrition area. Our senior nutrition program, our Meals on Wheels, or home delivered meals is what it's affectionately known as. We were able to enhance and do more, right? So we were able to provide a second meal to an individual that perhaps our traditional funding might not allow us to do that at start. We were able to bring weekend meals to the table for individuals that needed it. And then it allowed us to continue to bring new clients onto our program, even though we weren't sure what additional state or federal funding might be flowing down to us for our service areas. So it was a real big help for us to have received the funds from CSERF.
That's so fantastic to hear that Sakoa's senior nutrition program really was able to not only be enhanced, but to hear that you even provided more meals to those neighbors that needed it most, Tarek. Thank you for sharing. Jennifer, I'd love to hear from you. What did your team have to do to change and how you were doing your work in response to COVID-19 at Second Helpings?
So in normal times, Second Helpings meals are often served in buffet lines or in other ways where large groups of people come to eat together. Second Helpings had to shift overnight. And there was one morning in March where our staff was at the restaurant supply store when they opened, buying disposable containers so meals could be repackaged into a grab and go style that people could then take and reheat at home. We've been distributing most of our meals that way ever since. We've also partnered with more than 50 new agency programs as part of our hunger relief program. We added a home delivery service and brought in catering and restaurant partners as satellite kitchen operations to help with the increased demands. And much like in the schools, our culinary job training program was revised to a hybrid model, allowing students to limit their in-person contact to hands-on cooking skills. All of this is happening amidst a major reduction in volunteer hours. Between social distancing requirements and the reality that many of our volunteers are in high-risk categories and needed to stay home, much of that work has now been supplemented by temporary staff and National Guard troops.
Oh, those are great examples, Jennifer. And even hearing how Second Helpings has expanded their network of partners and organizations to increase the work that you're doing, that's phenomenal. And I'd now love to hear from the three of you. Have you seen more collaboration during this crisis? And it sounds like you have just from the first two answers that we've heard. And if so, give us an example of how you've collaborated and perhaps even if that CSER funding helped to make that collaboration more accessible to each of your organizations. Barato, do you mind kicking us off with your first reply?
Absolutely. First off, just appreciate the opportunity to kind of share how we've been able to adapt and evolve to make sure that we're continuing to serve our neighborhood and our community. Certainly CSERF was a very instrumental, very critical tool to allow us to be able to adapt and continue to serve in ways that we had never originally contemplated earlier. With regard to your question on collaboration, we've been very thankful to have been able to collaborate not only with the other two panelists in terms of our food distribution and food access. As Sarah had mentioned earlier, the Edna Martin Christian Center is grateful and humbled to be a partner of a larger connection of neighborhood community centers who collaborated with the city of Indianapolis toward the Indy Rents Initiative. Our organization by itself has distributed over $2 million in rental assistance and support to stabilize housing, stabilize families in our neighborhoods that have been impacted adversely by COVID conditions. That has been a huge advancement or an enhancement for us to be able to provide that stability while we're also partnering with other organizations on food distribution, working with our schools to make sure that we can provide a semblance of connectivity and access for our students going through e-learning. And just more importantly, equally importantly, to one of the things that Sarah said, as we've continued to evolve, we continue to try to adapt. We have all dealt with the stress of having to risk ourselves, our staff, or the individuals that we serve in favor of trying to make sure that our community is well taken care of, and having the ability to connect and be a part of a community of practice where we're getting insights and supports from our partner organizations in a way that the silos have been just totally taken down in favor of collaboration, partnership, resource maximization for our entire community has been something that Edna Martin has certainly been very thankful and humbled by in partnership. But again, it really has been a good demonstration of what communities can do and neighborhoods can do when they all band together for a common cause.
Yeah, Barato, that's so special. You sit at the epicenter of neighborhoods and community growth. I'd be curious, has there been either an anecdote that you've heard either from parents that you're serving or family members or even students that have truly benefited from the Edna Martin Christian Center and the work that you've done over the last few months?
I'd say on a number of levels, at various points throughout our continuum. I could point to cases where neighbors and individuals that have been served have felt like we provided a valuable service, whether it's the continuation of our case management for 2Gen services, the fact that we still hold our students to the highest standards, even in an e-learning environment, and partnering with the schools, and most importantly for us, very early on in this process or in this crisis, one of our biggest concerns was our senior population, right? Being able to alleviate social isolation, connectivity, food access, and being able to find creative ways for our seniors to still stay connected to us, I think has been one of the things that has been equally gratifying. So again, there are stories across the board, across our full continuum that we're just really thankful to be a part of. But I think, again, what's telling for me is walking through our center and still seeing our students on their computers, still trying to make sure that they're meeting their grade requirements and being able to connect with them really is very fulfilling.
Great to hear. Thank you for providing that sense of normalcy, especially in times of uncertainty. Jennifer, you mentioned the 50 organizations that Second Helpings has brokered partnerships with. I'd love to just hear more about how the CSER funding really helped to make those collaborations more accessible to you and your team.
Well, one of the things that CSERF made possible is we have never said no during this pandemic to any organization that came and asked for our help. That's when you consider the scale of bringing on 50 new partner organizations, that's something we simply could not have done if we didn't have the confidence that the funding would be there to support the work. When you talk about a collaborations, on a macro scale, Second Helpings Gleaners and Midwest Food Bank have worked closer than ever during this pandemic. And starting in its very earliest days, we addressed funding, food supplies, facilities, all of those things together, because we knew that all three organizations had to be operating at full capacity and then some to address the needs in our community. I suppose one of the best examples of that collaboration is the home delivery program that we started together. Mm-hmm. Indian Hunger Network staff are answering the call line every day, and we have 913 Sports that is delivering pantry boxes and Second Helpings frozen prepared meals to people who are homebound and to low-income families who are struggling with quarantine or who are ill. Mm-hmm. And we couldn't do that work without the support of CSURF, the Lilly Endowment, United Way, and all of the funders who made this possible. It's 4 organizations coming together to build a collaboration and filling a critical need in our community.
Jennifer, give us the highlight of scope and how many meals you were able to serve and or volunteers. I'm sure you've got the cliff notes, but I can imagine just the power behind that collective impact.
So if you look back to the biggest months of April and May, we were operating at 2.5 times our capacity. Second Helpings is going to distribute more than 1.5 million meals this year. That's a number that would not be possible without the support that we have received from CSURF and other funders in the community.
That's truly remarkable. Thank you for sharing. Tarek, what about you? Share some of the collaboration that you've experienced and how the CSURF funding in particular helped to enable that.
Yeah, well, first, let me say collaboration is at an all-time high here in Central Indiana. Many folks don't know this. I just recently started here in January. And so collaboration prior to this crisis was great. To me, it's been amazing throughout this public health emergency. We hold collaboration in a very high regard at Sakoa. And, we always are willing to collaborate and have collaborated with other community business organizations, health systems. We are members of Indie Hunger Network and really lean into, to that group to help with the meal gaps that we all know exist here in our communities. And then our own meal vendor, Chef for Hire. We've been collaborating with them, especially more so since COVID, because we did have to move our lunch site clients over to home delivery. And so that it potentially could have caused some challenges for them. So, we've had to do more collaboration with them. But one of the things that I'm really happy about and want to talk about in this section is one of the things that we needed to do was, since our lunch sites were closed, and those are the sites where wellness activities would take place. What we did was our Vista from Indie Hunger Network, who does our bingo size program, was able to find a technology platform to put that on. And we're now doing those virtual bingo size wellness activities for clients in Shelby currently, but we're looking to add the other counties in our service area as well. So that was something that was really cool. And we didn't think that it would be possible to stand it up as quickly as we did. But again, from all the support from CSURF and other funders in the community, as well as at the state and federal level, we were able to do that.
That's great. Thank you all for sharing more about your collaboration efforts. I'm sure many of us on the call today are really firm believers that it truly is that secret sauce to our Central Indiana community. So I'm so happy to hear that it's impacted your organizations greatly. Jennifer, back to you. I'm really curious to hear what your work might have looked like perhaps without CSURF funding.
Wow, I try not to think about what it would have been like without CSURF funding. Plainly, we could not be doing this work at the scale that we're operating at right now. As I mentioned, we've been able to say yes to everyone. And it's really important to note that much of the other funding that came along for COVID came later. But we had to respond right away. And even before we had figured out what we needed to do, we already knew that CSURF existed and that these funders had the backs of our not-for-profit community. The CARES Act dollars came in months later, and that early injection of CSURF funds gave all of us the ability to be bold and to expand our operations quickly, knowing that the funding would be there to cover it. When I talk to colleagues in other cities, I hear over and over again that they know what they should be doing, but they can't get the funding to support the work at the scale that it requires. And fortunately, that is a challenge that we in Central Indiana have not had to face.
I love that be bold mantra that the CSURF fund really helped to allow Second Helpings to embrace. That's really great to hear, Jennifer. Tarek, I'm curious, how do you think the landscape of philanthropy has changed since COVID? I know that you mentioned that you were new in this role. So any background that you can give us regarding your perspective to philanthropy at large and how it's changed
Yeah.
these past few months?
Yeah, thanks for that question, Lauren. Obviously, 2020 has been a year that I want to move away from, right? It has impacted all CBOs doing in-person fundraisers that they typically would do. You know, through my lenses, I've begun having some discussions internally with our VP of development about reimagining what that philanthropy, what our philanthropic strategy and playbook might look like moving forward. I think this is a great opportunity for all of us to kind of pause and take a look at what it was like and begin reshaping it to what that new normal is going to be. There might never be a time where major gatherings can take place. So, you know, again, we want to be open-minded and try and really reimagine what that could look like from the individual donor side, from the major gift side, you know, from different angles to really try and do some different things from that philanthropic perspective.
That's great to hear. Jennifer and Barato, I'd be curious, have you seen philanthropic efforts change either from your vantage point or with the donor interaction that you've had over the past few months?
Well, absolutely. We like everyone else have had to take events virtual, and but I've been heartened by the way that the community has stood by us. So many of our sponsors have stuck with us through virtual events, and donors have stepped up. So that's been great during COVID. I think the real challenges are for the long term. And the real challenges are what's going to happen when we get past COVID, because for those of us who work with clients in poverty, a vaccine isn't going to make everything go back to normal. It's going to make some of our operations easier, but if we look back to the heightened food insecurity that came with the Great Recession, it took 10 years for our country to return to its previous levels. So the challenge of philanthropy and how philanthropy is changing, the challenge is really going to be, how do we continue to support struggling families, not just through the spring and not just through the summer, but through the long-term effects that COVID is going to have on these struggling households.
Absolutely, yeah. Jennifer.
So just echoing that, I think, you know, again, it goes without saying, the ability for us to maintain service, to evolve and adapt and do it so quickly as a result of the infusion of dollars for CSERF was something that also, I think, from a philanthropic standpoint, allowed us to reach out to our funders, donors, our diverse list, to show that we are still finding a way to operate and serve without actually limited interruption. As a matter of fact, increase our ability to serve even in the most trying periods. And we were thankful, again, to be able to leverage some of the support that we were able to receive while still being able to maintain our current levels as an opportunity to show, again, funders, individuals that wanted to give, that wanted to find good ways to channel limited resources in the most impactful way, the ability to do that. The visibility and the outreach that came as a result for our continuing ability to serve was something that, you know, really allowed us to focus our efforts on the actual work itself, right? That's not saying that we don't anticipate what we need to do from a fundraising standpoint to evolve, to continue to reach out. But again, having that firm foundation and demonstrating that, that we're able to take the resources that we've been blessed to receive and serve people in unprecedented ways was something that gave us a little bit of breathing room while the philanthropic community still found smart, effective ways to maximize our resources.
Yeah. Thank you all for sharing. I'm sensing some major themes. You're heartened by your donor engagement and that partner engagement. You've been able to have an opportunity to maybe test some creative ideas, but ultimately you're searching for long-term solutions and continual support. So speaking of long-term solutions and where we go from here, I'd love to hear from the three of you. How do you see your organizations pivoting and maybe getting to work over the next 6 months to a year? And if you could, in that vision you're laying forth for us, talk to us about what continuing needs you might need in that time frame. Jennifer, do you want to kick us off?
So one of the things that we've all accepted is that we're not going to be the same organization coming out of COVID that we were going in. We have all learned new things through this, and we've developed some new models that we actually think may even work better. So when I talk about things like our home delivery system for people who are homebound, when I talk about the changes we've made to our culinary job training program, many of those things we're now working to figure out, how do we institutionalize the best of what we've learned during COVID. So I think that that is certainly going to be a theme that we will have for the future. The other thing is, of course, we're looking forward to bringing volunteers back in a big way, because they are a major part of the workforce that prepares and delivers these meals each day. They are critical to this organization. They double the size of our staff. And so we know that one of the challenges moving forward is we're going to have to do some rebuilding of that volunteer program for the future. And we're going to have to make sure that we continue to share with our donors the tremendous impact that they are having in the lives of people in our community, even beyond a vaccine. And that the need, I expect, is still going to be very significant for families in our community who are struggling to make ends meet.
That's great to hear, Jennifer. Barato, what are you seeing?
Well, we'll continue to struggle, certainly at the level of our youth, trying to make sure that we are finding opportunities to still have programs both on site, recognizing that our school age youth in particular are going to, especially in the neighborhoods that we serve, are going to be impacted some way. We are not going to know the true impact of what this e-learning and this distance from their traditional education environments are going to look like, but we know that we'll have to continue to position ourselves in collaboration with our schools and our families to make sure that we're providing as much supplemental support as we can to help our students get back on track. The same thing as it relates to our family stability overall. We're not out of the woods yet, and we know we've got a long way to go to really ensure that our families and our community does get to some semblance of greater normalcy. We look at that as an opportunity to continue to demonstrate that through partnership, we'll find ways to stabilize our neighbors, stabilize our houses, stabilize our community as a whole. But it's going to take some work, right? We're hopeful that we'll be able to continue to maximize the resources that we've been able to receive to keep individuals in their homes, to make sure that they still have the ability to have their utilities and all of their food and access needs met. But again, I just think over the next 6 to 12 months, we are in it for the long haul. And again, we've been so fortunate and blessed to be able to demonstrate that through collaboration, we can maintain effective change and keep our families intact as best we can.
Quite inspiring, Barato. Thank you, and keep up the great work. Tarek, what's your vision for the next few months into the year look like for Sakoa?
Yeah, I tend to agree with my peers in what they have shared. The next 6 months to a year, it's going to be a struggle, a challenge. We've got to dig in, right? And we've got to continue doing what we are doing. For me, I'll be advocating for some of these alternative ways that we've been able to make contact with our clients and have that contact count as a billable activity. My hope would be that we advocate to continue to have those things made permanent so that that type of work can continue, whether in every other contact being virtual, the next one being face-to-face. So that's one piece of it. I think that second piece of it is we at Sakoa do know the toll that this public health emergency has had on one of our funding streams through the state. And so all the AAAs, all the area agencies on aging know that our choice funding is going down. And it is going down in large part based on the challenges that we are going through as a result of COVID-19. So, we're going to be talking about how we can lean into others to maybe help us continue to serve folks without that funding being at the level that it was at in prior fiscal years. And we do know that that will carry us through FY23. So the next 6 to 12 months will be, roll up the sleeves, dig in, and just really kind of figure out. And then the next 6 to 12 months thereafter, I think we all will begin to see more traction and momentum, and hopefully stabilizing our organizations and our abilities to continue to make deep and lasting impacts in lives.
That's fantastic. So I'm hearing there's still more work to be done. That's not a surprise. Yes. Resounding themes to me from that last answer. We've got to bolster that current work with the partners, even considering institutionalizing those best practices that we've learned from COVID. Love the inspiration to bring back volunteers in a big way and continuing to focus on each of the organization's best work that you're already doing. Jennifer, Tarek, and Barato, thank you so much for the work that you do and for the time you've given us this afternoon. We know that your efforts have certainly been challenging in a completely new and unprecedented ways. And we were just really grateful to have you and your colleagues as a part of this endeavor and for all that you've done in our community. Thank you for being with us.
It's my pleasure.
So as we wrap with our time here approaching the top of the hour, there's another community-based organization who has continued to adapt and adjust through the pandemic, and that is the Children's Bureau of Central Indiana. Here to provide a brief glimpse of their work, especially through COVID, and the ways that their donors have really helped to enable them quickly and meet childcare and family needs during these unprecedented times is their president, Tina Clower.
Children's Bureau makes a lasting, positive impact in young people's lives.
Children's Bureau has been serving children and families in this community since 1851. The agency's vision is for every child to have a healthy family. Its programs have changed over time, but its mission to preserve families and protect Indiana children has remained the same. In March, it became apparent that we were dealing with a reality that none of us had ever experienced. Our teams quickly assessed what children and families might be facing and then developed creative approaches to answer the community's needs. We increased our use of technology organizationally and immediately transitioned to providing emergency relief services along with emotional support for families. We have served 3,126 Marion County-based families since the beginning of the pandemic. With the help of COVID relief funds, our case managers responded promptly by delivering rent and utility assistance, diapers, formula, food, and personal protective equipment like sanitizer and masks. We anticipated the need for a safe place to care for children whose caregivers were hospitalized due to COVID. Caring for children affected by COVID was outside of our normal, but we knew that we needed to figure it out, and we did. The Friday that we learned that we would receive COVID relief funds was when we began emptying out a wing of our corporate office to create a space that would allow us to care for these children. By Monday, we had a new shelter unit called Project Courage, and we accepted a pair of toddlers as our first guests to the new COVID unit. We have provided quarantine services through our shelters to 260 children and youth since then. It would seem that we're living in a time when it's much easier to be divided than together. It's easier to take sides politically, fiscally, and socially, and it often feels like there's little common ground. But at Children's Bureau, there is a common denominator, and it's that we believe that each child and family is immeasurably important. We want to thank the donors who provided COVID relief funds. You allowed us to provide critical support to children and families in our community, and we are deeply grateful.
Children's Bureau, partners on the road of life.
Before we conclude this afternoon's program, I want to take a moment to briefly thank each and every one of you. Your gifts to United Way, for joining us here today, and especially for your continued commitment to making Central Indiana a place where we're really proud of the quality of life for every single person, each of our neighbors who call this community home. I'm certainly a firm believer that this city has given us one incredible gift, and if we do our jobs well, we'll give that gift right back. So before we depart tonight, it's my honor to introduce United Way CEO and President Ann Mertlow to share her vision and version on United Way's continued leadership during these uncertain times. Thanks for being here with us, Ann.
Thank you, Lauren. And I want to start by once again recognizing Rafael Sanchez, our board chair, and all of our panelists today. We have a fantastic board of directors, highly engaged, that have supported rapid innovation at United Way, that positioned us really well to respond quickly and effectively in times like these, as well as in normal times. You've heard from Sarah Van Slambrook, who as our Chief Impact Officer leads our impact team. And there are a host of other United Way team members who have really risen to the challenge this year to shine in uncharted territory, while also facing significant hardship in their own lives. And of course, I'd like to thank the 3 agency partners that participated in our panel today, Jennifer, Tarek, and Barato, all from agencies that do such important work in our community. These are all very talented leaders that demonstrated an ability to innovate and collaborate on the fly and meet the demands on the ground. None of us had ever done this before, and they certainly rose to the challenge. Last but certainly not least, I'd like to thank Lauren Peterson for leading this discussion, and for your passion and commitment to and advocacy for United Way and the work we do. Lauren, just listening to you is just warms my heart, because I know how much you care. So today is Giving Tuesday. And we hope we've given you a deeper connection to the important work of United Way and our community partners in the human services sector. We hope we've given you a behind the scenes account of this unprecedented year, so that you can truly see the impact that your dollars make for people who are suffering in this crisis. Because right now our community is still suffering, and it will be for some time. We had 216,000 households that were financially insecure in Central Indiana before COVID, and we know we will have many, many more after. Emergency relief is the first step in dealing with the crisis, but United Way and our partners on the ground are here not just for that phase, but also for the longer term recovery, the work it takes to get people stabilized and then to have the opportunity to grow. As we saw at the outset of the COVID crisis, the escalating spread of the virus is leading to desperation, which in turn is giving way to a renewed desire to help. The burden of this surge is weighing heavily on our healthcare system, our schools and teachers, on individuals that are out of work and facing eviction, on our seniors that are struggling with isolation, and on families waiting in long lines at the food pantry. On behalf of all of our struggling Central Indiana Hoosiers, and with your generous assistance, I can assure you that United Way is giving it our all. If you can join this effort, we would continue to be grateful to all of you. Either today on Giving Tuesday or in the spirit of giving this month, please consider a donation to the COVID-19 recovery and rebound effort. Just simply go to United Way or uwci.org and click Donate Today on our website. I want to thank you so much for joining us today. Thank you all for being part of the United Way family. And most of all, thank you for giving so generously to help our community thrive and return to what we all hope is a new normal, one that is even better for more families in our community than it was at the outset of this crisis. Well, Thanksgiving is over and it's the holiday season, so let me end by wishing all of our participants and attendees this evening a safe and happy holiday season and a much brighter new year. Take care, everyone.